Hey guys, Dr. Joe again. I want to talk about something today that I get tons of questions about all the time, and that is dental crowns. What are they? Where would you need them? Why would you need them? When are some situations that you wouldn't want to get them? All that is what we're going to be talking about today. So first of all, I want to say that let's just define what crowns are. So crowns are a way that we can take a tooth that is pretty broken down and has a lot of decay, things like that. How can we get that tooth to last for you? So what we do is, a lot of times we'll clean the tooth out, get all the decay out of it. Then we'll build that up with filling material, and then we'll take and carve around the sides and the top so that it's kind of like a hat that fits on your head. And the idea with that is that we're trying to get this tooth some longevity so that it can last you for many, many years. I've seen crowns with really good, people with good home care, they can last, I've seen them last 50 and 60 years. So if they're prepared right, and if you've got really good home care, they can last a really long time. Now, when would you really want to get that? Well, that comes down to if you have a tooth that can be saved by cleaning out that tooth and doing the crown. The big thing we want to look at is there enough tooth to save? So if we can take and clean it out in a way that is going to last, that's going to be huge. The tooth that you would not want to save by doing a crown is one that that the decay goes too far. So for example, let's say that you're having a lot of pain with a tooth, or that tooth is split and fractured. Good chance that you would not want to save that tooth with a crown or a root canal or anything else. We want to make sure that whatever we do is going to last, not just a year or two. We don't want this to be just a band-aid that just gets you a year or two down the road. We want to make sure that whatever it is that we're going to do is going to last ideally a lifetime. Now that's a pretty tall order whenever we're coming to crowns and fillings and things like that, but it's something with good home care, it can be achieved. One thing that you really want to look at whenever you're deciding on if you want to get a crown or not is, would you be better off in just doing an implant? So if a tooth is not going to last you a long time, a lot of times what I'll do is we'll take the tooth out and we will take and put in a graft. So whenever those tooth roots come out, we can fill that area in with bone graft. It's sterile bone, and then we can come back in the future, we can place an implant, and then we can get you a tooth there like you've never lost it. Now that's really, really handy because you don't have to take it easy on that tooth. You can chew on it just like you would a natural tooth, and that is hugely important whenever you're talking about the quality of life. Because I hate telling somebody, you know what, nope, you can't eat this, you can't eat that. That's because you don't have the teeth in order to do that, or your teeth aren't strong enough. But whenever we can take and get things nice and strong by doing an implant, doing a crown, then it's really nice to not have any limitations on what you can eat. Another thing to consider whenever you're getting a crown is if you're having any pain during that process or after that process. Sometimes people think, man, that crown, it hurts for this reason or that, but a lot of that has to do with us cleaning out the decay in order to prepare that tooth for its crown. Now, the deeper that we get into that tooth whenever we're cleaning it out, the more risk there is of having some sensitivity. If that sensitivity gets worse and the deeper that filling or the buildup under that crown is, then the more likely that we're going to need a root canal. Now, I certainly do not propose doing root canals on all teeth that need to get crowned at all, but every once in a while it is necessary. Now, if that has to happen, everything that we've done already can stay. So if we've built that tooth up and let's say we've put the crown on there, all of that can stay. In situations where we already have that crown placed for you, then we can take and drill just a little bit of a hole in the top of that tooth, clean out the nerves, fill that up, and you can keep everything else that you've had. That way you get the pain taken care of and you don't have to replace everything that's already been done. As far as what things look like for the long term, you're definitely going to be able to hold on to this for the long term. One more thing to consider whenever you're thinking about getting a crown or needing a crown is when that crown is done in sequence with your treatment. Let me explain. If all of your teeth are aligned pretty well and your bite is pretty correct, so your bottom and your top teeth meet pretty well, where your back teeth are grinding and your front teeth are biting, and we don't have a lot of overlap and we don't have a lot of heavy wear, if all of your teeth are positioned properly, then generally we can go ahead and do the crown that you need and move on from there. But if your teeth have a lot of overlap, if those teeth are crossed up, if you have a lot of wear, if those teeth are not meeting up top and bottom very well, then we may want to consider getting the teeth aligned first and then coming back and making the crown to the new bite that we've created. Now this does a couple of things. One of the biggest things is it makes sure that you get longevity out of not only the crown but also all the rest of your teeth. Because if we're hitting in one area here and there, it can break down very, very easily. But if we're hitting evenly across all of your teeth, that is huge in making sure that your teeth and crowns last. So if that's the case, by far the best thing is come in, let's have it. We need to have a conversation with your dentist, wherever you are. Have a conversation first with someone who's very fluent in how the occlusion or how these teeth come together with top and bottom. Because it's extremely important to get that right, because it's harder to do down the road after you've had the crown. But it's very easy to do beforehand. It's just a conversation that has to be had. So what we do in that situation is if you're a candidate for it, we would take and use some clear aligners to align those teeth and get them to where they're biting correctly, and then we would come back through and do the crown afterwards. Now many times we'll want to clean out the decay first. So let's say you have a big tooth and you know it's going to need to be crowned, and you also have some teeth that are very crossed up, so we know we've got a couple of things on our radar here. We'll want to take and clean out the decay first, and then put filling material in there and get it into the shape of a tooth. But we don't want to do the crown quite yet. We want to take and make sure that the tooth is decay free, then align those teeth, and then put our final crown on there so that it meets your other teeth the way that they're designed to do. After we've done that, it takes a few more steps, but you have to look at it from this perspective. Are we trying to get by with a couple of years here, or are we trying to create a situation that you're going to have these teeth for the rest of your life? For me or my family members or anybody else who comes through our doors, I want this to be a permanent solution for them, because I hate having to have the conversation of, yeah, I know we did this a year or two ago, but now we've got to do something else. Remaking work it's frustrating for both parties. So I try to eliminate that anywhere we can. The next thing when considering crowns is materials that it's made of. Not all crowns are created equal, not even close. So one of the biggest things that we want to do is create teeth that look extremely nice in the area, and also ones that are going to be strong enough as well. So that's why we choose porcelain crowns in almost all situations. There are a few situations that we would choose something else, but most of the time we're going to choose a porcelain crown that we can match color-wise to your teeth, and they're very, very strong. Also, if you've ever seen a crown that has up near the gums kind of a dark area, that's because that's a porcelain material layered over metal, and that can a lot of times look not quite great if your gums pull back a little bit and expose that edge. So I'm not a big fan of using that. In order to make these crowns not only fit and function, but also look really nice, it's extremely important to design it really well. And what I mean by that is that whenever you're coming in, I'm gonna make sure and make the edges tuck up underneath the gums most of the time so that this has a lifelike look. It's important that these look like they belong in your mouth. It's important that they look like they're coming out of the tissue in a natural way. If you've ever seen a crown that kind of looks like a chiclet, that's what they call it. Anyway, a chiclet tooth, where you have it, all your other teeth are looking nice, and you have one tooth with a big gray area, or it's off colored, or it's out of a line, or something like that. I feel like we've all seen those. But we very much want to make sure that that is not the case. And with some careful planning on the front side of this, it's an easy problem to avoid. I know there's a lot of confusion where you start. A lot of times people haven't been to the dentist in a while. Maybe they have a dental fear, something like that. It can be overwhelming with all of the different technology that's constantly coming out and the huge strides that the dentistry and also healthcare as a whole are taking. And so that's why I always offer people, if there's any questions in that regard, you can come in for a free consultation. We'll sit down and we'll take some images if we need to, so that we can really start to figure out where you want to begin and figure out also what's going to be a good fit for you. Because every single person is going to be different in the treatment that they need that's going to be a good fit for them. Everything from timeline to budget to distance, basically distance from us that they are. We have people come from all over the state, and so we very much want to get that correct so it's as convenient as possible, and also so that we get the best result possible. So pretty much no matter what you need, implants, Invisalign, full mouth rehabilitation, traditional dentistry, pretty much everything in between, we can very much get you taken care of and get you kind of started down that right path. And it all really starts with a conversation. Something that's extremely important to note is whenever people are looking around at getting a crown or really dental work at all, it's important to realize that every place that you go into, they're going to do things a different way. So all dentists are very much not trained equally, and you're going to get a dramatically different experience a lot of times from dentist to dentist. So whenever you're looking down that path, make sure that you are working with someone who has a lot of tools in their toolbox. What I mean by that is that if you're going to someplace for just basic dentistry, that's fine, but they need to be able to have a very good understanding of alignment of how these teeth need to fit top and bottom. They need to understand implants. Having a cone beam, a three-dimensional scanner is, I think, one of the single most important things that you can look for as a consumer. That's actually what this machine is right here. This allows us to see in 3 dimensions the jawbone, the sinuses, nerves, and blood supplies, everything that we need to dodge as professionals, that is going to show us. And if a practice that you're going to does not have that, it's very easy to overlook things that are very easy to see clearly with that. That's something that we always offer. We offer free consultations with 3-dimensional radiographs because that allows us to see everything in one view so much more clearly, so that we can develop a plan for you that's going to really kind of check all the boxes of what you're trying to accomplish. Now, everybody works at different paces also. I want to throw that in. There is no right or wrong way. Whenever you come in, the biggest thing that we're going to do is sit down and devise a plan. We're going to figure out how this needs to work for you so that we can move forward in a way that's going to get you there, but still be compassionate with the drive that you have with your, be it budget, timeline, all those types of things. It's very important so that we can have a good outcome for you. But the cone beam, the 3-dimensional, that's extremely important. And if you're going to a place that has the knowledge of each of those technologies, they're going to be able to look at your mouth through the lens of what each of those technologies can do to help you. So if you only have, as a dentist, the abilities to do fillings and kind of the basic things, that's fine, but there's so many other situations that require a deeper understanding of those technologies so that we can get you really to a place where you need to be. Everywhere from sinus surgery to implants to dentures that are held in a way that's more low profile. All of those types of things, it's extremely to have that technology and that understanding of it. As always, please do subscribe and like. That helps us a whole bunch so that we can reach more people and help more people get to the smile they've always dreamed of. So thank you again. Talk to you next time.